Hello, welcome to the Wellness Lab podcast, where we strive to provide valuable insights, information, and overall content that will help drive your wellness. And well, as you know, we have different topics to discuss from a week to week standpoint. And today we have Alex Hanham, who has been leveraging and excelling on overall how to innovate on care, preventative, and with technology, how it's serving Canadian market, specifically Ontario, London, Burlington locations. And we have the pleasure to have Alex today with us to give us the main insights on how it works. What are the key things that you can achieve from a health perspective, from a preventative perspective. And it's not only for individuals, it's also for corporations, for businesses that are interested to support their employees on their health and wellness. So without further ado, welcome, Alex, and I'll pass it over to you to give us a quick overview on your background, who you are, and then we'll dive into the conversation. Thanks for being here.
A pleasure to be here. Thank you so much for having me. I don't really know where to start as far as you want to talk about me. I guess where MedPoint really got started is that my wife is a family doctor. I was believe it or not, in television. What's interesting about Burlington is I actually grew up in Burlington. I went to high school in Burlington, and we met at University of Western Ontario. Years later, we moved back to London, Ontario, and where she went through medical school. While she was going through medical school, I was working in retail for a while, and then I started working in television. And as she graduated, she really felt like there was a number of challenges with the healthcare system. Sometimes what a lot of people think is that doctors, they graduate and then they know exactly what to do. And the healthcare system kind of just says, there you go, you graduated, be free, go. And so a lot of doctors, they start working in walk-in clinics. They don't really want to start a practice. And one of the things that my wife really found was that she was dealing with a lot of acute health or chronic health issues that could have been solved if someone had taken a focus of prevention years earlier. So she would have people who were having diabetes, cancer, heart disease, and she really found that there was our healthcare system was reactionary more than proactively. And this is 23 years ago that she really felt that what she was training for in medicine wasn't really being implemented. So at the same time, she gave me a book called Boom, Bust, and Echo, which is a Canadian book by an author by the name of David Foote. Talks about demographics, and it talks about what the baby boom generation was going to do, and if you're going to start a business, how did demographics impact that business? And what we realized was that there was going to be this surge, this silver tsunami of baby boomers who are going to crush our healthcare system. What I don't think a lot of people realized was that even though that the demand for healthcare services was about to go through the roof, people didn't realize that the supply was also baby boomers. So nurses, doctors, technicians, they were the ones who were in this industry, and they were getting ready to retire. So we knew there was going to be a lot of, again, an increase with so many people getting older and needing more healthcare. We also had, at the same time, had a diminishing supply. And when you have a lot of demand and a lower supply, you have a problem. So right now, we decided, I looked at that and I turned to my wife and I said, I guess my next career is healthcare. And she said, I don't want to work with you. And she was probably smart to say that. But we looked at what some of the other options were. And we really saw that there was a hole in the preventative space. Our healthcare system was very much reactionary. You go to the doctor when you don't feel well. And ultimately, when you have a one-payer system like our OHIP system, you have to deal with the reactionary. If we only have so much money, if somebody's having a heart attack or if someone has cancer, we have to pour our resources into that because there's only so much money to go around. And I could get into the debate of how healthcare resources are used, but this isn't about politics. So as an individual, we're kind of trained of you only go to the doctor when you feel sick. And yet, when we design MedPoint, I can honestly tell you that the worst things that we find don't have any symptoms. They're walking around with cancer, diabetes, heart disease with zero symptoms. A good example of that is kidney cancer. 90% of kidney cancers are found incidentally. So there's no symptom until you get to stage 3 or stage 4. We've had cases where we've had people in their 30s walking around with a kidney cancer the size of a Coke can and having zero symptoms and life-threatening things. So you often, we have a little bit of a saying around here that genetics loads the gun and environment pulls the trigger. And we all know of somebody who drinks and smokes and has terrible lifestyle and they live to be 110. And we all know somebody who exercises, eats properly, does everything right, and drops dead at 40. And, those people, we all know those examples, but those people are on a spectrum. And the majority of us are, the more risk factors you have, the more likely something's going to get you. So if you drink alcohol, that's going to be a bullet in the gun. If you smoke, that's 2 bullets in the gun. If you don't exercise, that's another bullet in the gun. So if you're not taking care of yourself, likely one of those risk factors are going to get you. So at MedPoint, what we do is we screen for the early detection of cancer, diabetes, heart disease, fitness levels. We have a 3, 4, or 5 hour medical that we do that with. We give people options to doing that. Then our second pillar is healthcare navigation. We get people through the healthcare system as quickly as possible, including the private healthcare system, which has some ability to get to. And then last is lifestyle modification. How do we teach people to exercise properly, to eat the right foods, to reduce their stress, to increase their sleep habits or improve their sleep habits? How do we follow up with them to see if they're on the right path and take a proactive approach to healthcare as opposed to the reactive? Because if we can catch things early, 9 times out of 10, you get a better result than if you leave it and stick your head in the sand and hope that it all works out. So that's kind of what we do. I'm gonna keep talking. If you don't turn me off, I'll just keep talking. Talk forever.
Perfect. It's great, the approach and the way you've seen it. I've heard lots of times throughout the episodes we've been recording. Maybe there's already 30 plus aired, and that's what we've seen. Either the U.S., Canada, there's gaps within the medical system, obviously differences between both countries, how they operate and whatnot, but this preventative care, it's key. So there's a shift. You can name it. It can be because of certain issues we're facing within the system, within the healthcare, how it is managed and whatnot. And obviously there's a lot of demand and there's not as many resources available. But having said that, our duty as individuals could be, how can I take care of myself? What can I do proactively to really go and do all the things that are under my control to be healthy? So that's a great thing that obviously through MedPoint, you and your wife are supporting others. And I think that's key, because sometimes, especially you think I'm within this healthcare that it's provided by the government and I can't do more, and it's already saturated, and then what's going to happen until I really need something? I might go to my doctor or to a clinic or whatever, because I don't want to be waiting long times and just going through the hassle. And that's really important to know. There's an options, there's ways that you can really get the care and do it before you have any of these specifically things that you have already highlighted.
Well, executive health has been around for many, many years. And when we look at, what's happening in our healthcare system now, again, we came up with this concept 22 years ago we opened 20 years ago. We opened with one doctor in London and 3 staff, and today, and 3,000 square feet. Today we have 44 doctors. We have 72 staff. We have 30,000 square feet, and with our new Burlington location as well. And we really have seen that people want to have choice. They want to be proactive in their health. But as I said, executive healthcare, there's companies like Medcan and Cleveland Clinic and Medicis, which got bought out by TELUS, who have been doing this for a long time. And Medcan, for example, had a 35-year head start on us. And but they've essentially been focused on the C-suite. So the president, the CEO, the board of directors, because they're at a very high price point. And where we came in was we wanted to bring executive level healthcare to the general population. We really wanted to come in at a price point that was more affordable, offer monthly payments, make it work as a partnership with our clients to say, here's what we found about your health. Here's where you're at risk. Here's what we're going to do about it. Do you care about this? Do you want to be a part of this? Do you want to reduce your risk? And if so, how can we help you with that? At first, we've evolved. Like, you think that success is going to be like this straight line, and of course it never is. And one of the things that we have kind of prided ourselves on, I guess, is that we listen to our clients, we listen to our staff, and we had people come in and say, okay, I need to get through the healthcare system first. You got to get me through faster. And because that was becoming a bigger and bigger problem. So we developed a navigation system, and we also attracted a lot of doctors and specialists to work right with us. Like, we have one of the largest neurology clinics in southwestern Ontario. We have internal medicine, we have plastic surgery, orthopedic surgery, sports medicine, dermatology, it goes on and on, men's health, gynecology. So we learned that our clients don't just want to know what's wrong, but they want to be able to get through the system. And the other thing was, we would have people come through our medicals, and they would say, okay, so I'm overweight, my cholesterol is too high, I need to make some changes, fix me. And for many years we were just like, no, we're in the telling you what's wrong with you business, not in the fixing you business. But a lot of our clients that said, we want to do fitness, we want to do, teach us to do these things. We liked it here. So really about 2-3 years in, we started a fitness program, and we said, if we're going to do a fitness program, how do we incorporate what we're good at? And what we're good at is medicine. And if we're going to have combined fitness with medicine, let's have a medically integrated fitness program. So all of our trainers, we have 17 kinesiologists who work for Medpoint, and they all can read medical charts, and they all understand how the body works. They've all got university degrees in kinesiology at a minimum, and we have some masters as well. So we basically have a way with all of our medical testing to be able to create a blueprint for somebody to maximize their fitness journey. So, for example, in our 5-hour medical, especially in the Burlington area, we have a DEXA scan. And what a DEXA scan will do is it will give us a reading on the visceral fat that is around the organs of our clients. Visceral fat is the most dangerous fat. That's the bad news. The good news is it's the first fat that can get burnt off. We also have a cardio coach VO2 max, which will tell us, our clients, the heart rate that an individual will burn fat off personally. So you get on a treadmill, you wear a gas mask, it analyzes your blood gases, and it gives us your aerobic threshold and your anaerobic threshold. And as a former athlete myself, I can tell you, you could fill the room with what I didn't know about proper fitness and all the things that I thought I was doing. And I still train like I'm 21 years old, the way I learned to train. But when my staff get a hold of me, they're like, no, you're doing it all wrong. So, and most people train wrong. Most people do too much. And So for example, when I do cardio, I've always thought, okay, the harder you do cardio, the more fat you're going to lose. But in my case, uh, if I'm doing cardio, I'm going to do cardio at 130, 140 heart rate. If I'm going for a run, treadmill, rower, swimming, whatever I'm doing. After doing the cardio coach, I learned that I actually maximize fat loss at 87 heart rate. So if I want to actually burn fats, I need to keep my heart rate at 87. And so we create customized plans for our clients that is going to make them healthier. And in many cases, it's a lot easier to go for a walk at 87 heart rate than it is to go for a run at 130 heart rate. You can only go so far, right? So getting the whole fitness part has come from feedback from our clients where they said, okay, I don't want to go to a gym where somebody doesn't really understand me and does the whole push them too hard. And unfortunately, the fitness industry is completely unregulated. I could call myself a personal trainer. I just need a t-shirt to say I'm a personal trainer. All right. There's no regulation in that. And so the highest standard of training you can get is to become a kinesiologist. And because we are a medical facility, first and foremost, we only hire kinesiologists. You have to be educated in order to work at Medpoint in that role. Um, so again, we really fall into those three different categories of screening, healthcare navigation, and lifestyle modification. And as I mentioned, what we really want is we want to make it affordable for the general population. One of the disturbing statistics about healthcare right now is that a couple of years ago, they measured that in Ontario, we have about 2.3 million people without a family doctor. So unfortunately, right now, the actual statistic coming out from the Ontario Medical Association is that 40% of doctors in Ontario that are practicing today, 40% are 61 years of age or older, which means 40% of those doctors will be retiring in the next 5 years. We're expected to go to 4.4 million people in Ontario without access to a primary care physician. So our system is in trouble. The wait times for specialists is getting worse. There's no focus on prevention. So if people want to live longer, healthier lives, they're going to have to take their healthcare into their own hands. And they're going to have to say, what's my baseline? What do I need to worry about? How do I get through the system and who can help me get through the system? And what do I need to do to prevent that disease from happening in the beginning? And this, if people could see what I see in the statistics of what's going to happen to our healthcare system, we'd have a lineup out the door. Well, we're doing very well. We're in London. We're, year over year, 30% increase every single year. We just continue to grow. We opened Burlington in November with a beautiful facility. We actually we have naming rights on the building, so we're right at Walker's Line and the QEW. And the big Medpoint Healthcare sign just went up 2 weeks ago. People are seeing that. It used to say NFP, now it says Medpoint Healthcare. And we have a gym in there, and we have all of our medical testing in there. And we're gaining more and more doctors. And again, we have all of the resources from our London operation available to our Burlington clients as well. So it's been going great. And as I said, it's kind of good to be back home in Burlington where I grew up.
Yes, it's amazing that you are supporting the community and especially where your roots are. And it's really interesting to learn how the approach changes from obviously from individuals that are health conscious that want to do something for their overall health and wellness. It's the best approach is this one. Why? Because if you just go to your family doctor because you want to take care of one specific thing, let's say I want to make sure my blood, everything from a blood work is perfect, and they'll do their checks of whatever they feel like, depending on maybe sometimes what you are interested.
Yeah.
And then there's no connection between like, okay, you are trying to achieve this specific fitness goal or other things that might relate. So this one, it's a holistic approach, which is really important to highlight.
Mhm.
Perfect. And one of the other things that I think I saw somewhere and that you mentioned, the gym facility, is it 24/7?
So it's a personal training studio. So
Gotcha.
it's all part of our medically integrated program. So we're not open, we're not open to the general public. It's only for our clients. But as I said, if someone wants to make the number one motivator that we find in fitness, and as a former athlete, it's been always been important to me, is I want data. I want to know that if I'm doing a program, I want to know if it's working. And so with our DEXA scan, our members, because you can buy a membership with us, you can do a fitness program, but with our DEXA scan and our other testing, we will give you that number one motivator, which is feedback on results. So we can redo testing. We can do another DEXA scan and say, hey, you've lost, like we have one gentleman who we both know, who's doing some fitness with us. And he's already, he's gone from 305 pounds to 277 pounds, 275 pounds. But more importantly, he has lost 6% body fat. And, that's ultimately what you want to do. You want to you want to lose fat and you want to build muscle. And if you have a trainer who doesn't understand your own personal health profile, that's really hard. People are going to train wrong. And if you have a trainer who doesn't have a university degree in kinesiology, there's a good chance that if your trainer likes kickboxing, they're going to train you to be a kickboxer. If they like skiing, they're going to train you to be a skier, or running or whatever. With a kinesiologist, they understand how the body works, and we have all of that performance testing that is available to our clients, so we can keep doing that and saying, look, you lost 5% body fat, and here's the proof. It's working. You're eating properly. Or people are working out, but the old joke is that you can't outrun your fork. So if you're exercising but you're eating poorly, and then we get to test day and we do another test, and your body composition is it's not working, it's because you're not eating properly. And we can basically, there's no cheating in our program, right? We can find out what happens. But as I said, we're a medical facility first and foremost. And what we know is that if we can get people in alignment with their mental health, healthcare access, fitness, nutrition, we're going to start eliminating those risk factors that'll eventually, take us down. We have to be focused on doing everything we can, because, as I said, the healthcare system may not be there for us. And, being proactive in the approach is the best way. It's been successful for us. And as I said, when our goal wasn't just to be like, we have 300 corporate clients. We gain 10 new corporate clients a month. But we are really generating. And so for companies who want healthy employees, we have we have ways of, we have employee health solutions. We have executive medicals. We have solutions for people who want a healthier company or healthier organization. But a family is an organization. So you want mom and dad to be healthy. You want the kids to be healthy. So, we have really tried to keep our price points substantially lower. I would say that our 5-hour medical is the most comprehensive medical in Canada. It is arguably definitely, I would say it's the most comprehensive in Ontario. But we are $2,000 less than our main competitor. And we do more. We do a more comprehensive medical for less money. So we make it affordable for general population to say, I want this. And then if someone's a business owner and they say, I want this, but I want something for my employees as well, we have so many different options. We have a 3-hour medical, a 4-hour medical, a 5-hour medical. We have employee health solutions. We have a partnership with a virtual care provider called Maple. We have a partnership with a mental health institution called Inkblot. We can get our clients in front of doctors within hours and days as opposed to weeks. We can navigate the healthcare system. We have access to private MRIs, private CTs. We have, for the really bad situations, we have partnership with Mass General Brigham, which is 14 hospitals connected to Harvard in Boston. So we are there. I guess the main thing is we're health solutions. We're an executive healthcare center, and we can work with your family doctor, or we can work independent of your family doctor.
Great, amazing. Lots of tools or resources that are in place and that you've been taken care of throughout all these years. It's really a well-rounded approach program, and as you said, you are providing a solution that is accessible to the population, and it's for, as you mentioned, individuals, families, and also for executives or professionals. So great to learn all of these. I highly suggest anyone listening to Alex today, go check out Medpoint. You can obviously send an email, chat, and whatnot through their website and make a change, take a proactive approach for you, for your loved ones, because if you're okay, everyone around you will be okay. And if we are taking this proactive approach and looking at it from various ways, like preventing chronic diseases, doing a proper job from a nutrition standpoint, fitness, that it's a no-brainer. We have to do it. We have to take care of all those things together. Then we will not go into a situation that maybe we will not have the support in place through our healthcare. And it's there's options, there's solutions. We already heard today from Alex, and I know it's gonna grow. And Burlington just opened a couple months ago, and it's gonna do amazing, or it's doing great. So a great location as well, because it's so close from Toronto and other cities that will be available. Great facilities for sure.
And free parking.
Wow, that's
Free
a plus.
parking right off the highway. So it's the location is fantastic. As I said, it's from my office and from the gym. On a good day, we can see Niagara Falls and we can see the CN Tower. So it's a nice place to exercise. And as I said, it's really more like, how about when you go to your family doctor and it feels like a spa? That's kind of what the feel that we're going for. And again, the main advantage of being a part of Medpoint is our team. We are very accessible. You're not going to feel rushed. You're going to feel like, you're going to realize that we're on the same side and that we're going to try and do everything we can possibly for our clients to make sure they're as healthy as possible, because the longer our clients live, the better we do financially as well. We're invested in our clients' health. So
Amazing. And the word of mouth, that's invaluable for sure. So
huge.
that's great. Okay.
Yeah.
Thank you very much, Alex. Greatly appreciated. And I hope we have another chat soon of any specific topics. I know there's so much to cover, and these 30 minutes are not enough, but I know it's enough for the audience to at least get this information out, get the word out, and as well educate others. That's the best way to.
Yeah, if someone has a question, they can reach out to me very simply. My email, I'm always accessible, is just my name, Alex, at medpoint.ca. Our website is medpoint.ca. And if someone wants to come and have a tour, there's no obligation. Come in and have a tour of our facility, see if it's right for you, your company, your family, your children, whoever.
Lovely, amazing. Thanks for your kindness, for helping others. And we will also share all that information below when we release the episode.
Awesome. Thank you very much.
Amazing. Thanks.
Thank you. Bye.